Did you know that in the US alone, 34.2 million of people from all ages have diabetes? This is the 10.5% of the total US population. Out of those, 7.3 million adults were undiagnosed. That is so many people. What did they miss? There are 9 warning signs from your body that suggest high blood sugar and may be cause for concern. Increased thirst and frequent urination. Do you visit the toilet more often than before, especially during the night? The average person may urinate between 4 and 7 times in 24 hours, but people with diabetes a lot more. That is because the body is trying to get rid of excess sugar through urination. As a result, the more fluids you lose, the thirstier you get. So, unless you're drinking more than 2 liters per day, having a urinary tract infection, or significant stress in your life, frequent urination or excessive thirst may well be signs of diabetes or pre-diabetes. Unintended weight loss. Going to the toilet more often makes you lose fluids, which leads to weight loss. Moreover, what happens with diabetes is that your body doesn't produce enough insulin, or that your cells resist the insulin your body produces. Without insulin, glucose can't get into the body cells and be used as energy. As the body needs energy to survive, it starts burning fat and muscle, causing a reduction in overall body weight. So, if you notice a sudden drop in your weight, it should raise a concern. According to many experts, losing 1 or 2 pounds per week is a healthy and safe rate. More than that is considered too fast. Fatigue. Do you often feel exhausted? You also wonder why, as you didn't do much during the day. This happens, again, because of the glucose not being able to reach your cells and provide them with energy, and therefore you feel tired all the time. Blurred vision. High blood sugar levels can take fluids from certain tissues and cause the eye nerves to swell up. As a result, you cannot focus and might experience blurred vision. Dry mouth and dry skin. As we explained earlier in this video, high blood sugar causes frequent urination in an effort of the body to get rid of the excess sugars. The result is dehydrated skin that can become itchy. As a consequence, you may often have a dry mouth. Slow healing. People with uncontrolled blood sugar may develop poor circulation. Therefore, in case of injuries, nutrients will not be able to reach the wounds in time to properly heal them. High blood sugar can also prevent the immune system from functioning properly, plus increase inflammation in the body's cells. All these reasons hold up the healing process. Neuropathy. Do you feel numbness or a persistent tingling in your hands or feet? Untreated high blood glucose for a period of time may lead to peripheral neuropathy, a severe nerve damage that causes the affected area to lose sensations. It is common with diabetes that you do not feel your feet. You may also not be able to sense a wound that could get worse over time and lead to infection. Recurring infections. High blood sugar can weaken the immune system. Therefore, people who have diabetes for extensive time are more prone to infections like skin and soft tissue infections known as diabetic foot, yeast infections, urinary tract infections, and ear, nose, and throat infections. Fruity smelling breath. A fruity odor to the breath is a sign of ketoacidosis, which may occur in diabetes. When your body cannot get energy from glucose, it burns fat in its place. The fat burning process creates a buildup of acids in your blood called ketones and leads to diabetic ketoacidosis if left untreated. If you suspect your blood sugar might be high, you can check it to avoid developing some of the more dangerous symptoms. Here are the ways to measure it. Fasting blood glucose lab test. Get your fasting blood sugar tested in a lab, just like you do for your routine health check. You should do it in the morning, without having eaten for 8+ hours. Your doctor should evaluate your results and might ask for further testing, possibly an A1C test that shows your blood sugar average for the past 3 months, or a glucose tolerance test that evaluates how your body reacts to a certain amount of glucose. Another method is finger pricking. You can purchase a blood glucose meter that analyzes a small drop of blood off your fingertip and use it to test your numbers at home. This way, you can check multiple times a day to get the full picture, as normal blood sugar levels fluctuate and depend on what you have eaten. Simply put, in the 5 liters of blood that our body contains, the acceptable amount of glucose is limited to barely 1 teaspoon. In proportion, in the amount of liquid shown, 3 drops of glucose represent the healthy concentration. Another 1 or 2 drops represent diabetes. When you have your blood sugar tested in the morning, a generally accepted range is between 70 and 100 milligrams of glucose per deciliter of blood. A measurement of 101 or more suggests prediabetes, while results over 126 indicate diabetes and require immediate medical care. The other crucial time of the day to check your levels is 1 to 3 hours after a meal, especially if it's loaded with carbs and sugars. Healthy blood sugar levels should not exceed 140 milligrams per deciliter. Levels between 140 and 199 milligrams per deciliter indicate prediabetes, while 200 plus diabetes. Always consult your doctor for advice on your specific needs.